Some stark new numbers on the COVID-19 crisis in the United States. Deaths and hospitalizations are now reaching heights above what was thought to be the peak of the pandemic last spring. For the second time in less than 2 weeks, the Johns Hopkins University tracking site is reporting more than 200,000 new cases in a single day. Lindsay Duncombe is our senior Washington editor, and she is going to follow that story for us this morning. More than 200,000 cases in a day. Lindsay, tell us about the latest crisis there.
Well, the message from officials right across the United States is that the situation is dire and it is only going to get worse. As you mentioned, the data that we're seeing, Heather, is worse than it was at the peak in the spring. But what was different in the spring is that those cases were happening in one specific geographic area or in a couple of geographic areas like New York City and the East Coast. Right now, this crisis is unfolding right across the country. I wanted to have you take a look at some of this data, including the number of deaths. That is a record. More than 3,000 people died in the United States, according to Johns Hopkins yesterday. And then just look at the hospitalizations, another grim record. Right now, more than 100,000 people are in hospital, and that means, given that that is a record, officials say we will see that death toll go up. How much could it go up? Well, some really...
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
Deaths in the United States by February. Here's more of what he said.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
Now, he did stress that the efforts we've all been talking about will save lives, including wearing masks, staying home, keeping distant. But one of the unique features of how this crisis is being handled in the United States is that the response and the restrictions and the messaging does vary from state to state, city to city. We have seen some of those local governments impose stricter regulations in the past few weeks, Heather. Even just last night, the mayor of Los Angeles putting in a strict stay-at-home order. He said it's time to cancel everything. So certainly that message getting across in some parts of the country.
But what about at the federal level? What response to the numbers and to statements like that we just heard from Dr. Redfield? What kind of response from the Trump administration, Lindsay?
From Donald Trump, no acknowledgement of these statistics or the changing and devolving situation. In fact, what we got from the president yesterday was a bizarre 46-minute recorded video in which Donald Trump again tried to overturn the results of the election that he lost to Joe Biden, tried to really peddle these conspiracy theories that he has been losing out in court cases. So that is where the U.S. president's attention is. The president-elect does not get control over bringing this crisis into some kind of control until January 20th, when Joe Biden takes office. We will get some sense, perhaps this week, about the strategy there, Heather, because Biden is expected to name key members of his healthcare leadership team, perhaps in the coming days.
Lindsay, thank you very much. Our senior Washington editor, Lindsay Duncombe.